Welcome back to part 5 of my cancer journey. This is Sunny with Infinite Motive. We have come a long way since the start. We went through everything from the start of my diagnosis through the treatments of induction, consolidation, remission, relapse, and then ultimately bone marrow transplant. So that was where we left off on the last part. Today we're starting with my release. It was December 18th of 2019 that I was released from the hospital at MD Anderson. I was told as I was discharged that there was a very high risk of me having to return due to infection or any kind of complication. There's a lot of different transplant complications that can happen, and they were right for the most part. I was given a 50-50 chance of survival post-transplant. This is just given my mutation and what I had gone through up to this point, and I guess how they calculate the risk of relapse. And as much as it's beneficial that I had a related donor, there's many complications that I'll go over that could make things difficult in terms of recovery and possibly even survival. So sure enough, just like the doctor said, I was back January 4th of 2020, readmitted right after the new year. I was hospitalized with the flu and what I had mentioned previously, which was graft versus host disease. This is where the donor cells, in this case my sister, actually attack my body as a foreign body, because that's the new operating immune system, and this can range. It can affect all organs of the body, but your skin is your biggest organ, and that's the easiest one for it to end up being an issue. It can also affect your liver, it can affect your heart, your lungs, any organ. And for me, in my situation, I had skin GVHD. This was something that fluctuated for quite a while. I had basically experienced rashing and I would say raised skin that was very itchy, irritated. It was all over my body, my face. It was pretty unbearable. They gave me medications that I could use to start trying to limit the GVHD and calm it down and keep it from getting too irritated. The risk here is if you don't get it under control, it could worsen into a more serious situation. I luckily dealt with what would be considered a medium case of severity in regards to GVHD. So after I was in there for flu, their concern was that I would get pneumonia just due to my immune system being so weak at the time. Luckily, through that hospital stay, I didn't end up getting that. As torturous as it was in other ways, I ended up being fortunate enough to make it through, and I would eventually I would get through the flu okay, managed to clear up my cardiac issues that I was also having when I went in. I started itacitinib for skin GVHD. It was a clinical trial that I decided to go with, and I used triaclamone 3 times a day for the body rash. This was mixed with other topicals that they were having me put on. This was a very irritating experience for anybody who knows about putting topicals on. You're not going to want to lay in a bed immediately afterwards just because you're sticky and it's still not dry yet. But when you're going through the flu, you're as weak as I am at the time. It's a pretty torturous process. You're getting it lathered on, you lay down, you rest for a bit, and then rinse and repeat, basically. The main medication that I was prescribed to prevent GVHD was a medicine called tacrolimus, and it has very extensive side effects. For me, primarily it involved shaking pretty significantly, tremors and shaking, and this would continue for about 6 months. This obviously would impact my life daily, from eating, moving around, any of these things. I had some pretty significant shaking issues just through the chemo treatments alone leading up to this. Tacrolimus, I call it a lot of them call it tacro, ended up being just an add-on that would make this hopefully limit the GVHD, but also make it a more difficult side effects situation. March 2020 is when I was hospitalized again. This would be after some extensive time at home in between, but like I said before, these side effects don't go away. You're still struggling day to day, and I ended up getting re-hospitalized, had another GVHD flare-up. That this was, I had finished the trial drug itacitinib, and now I was being put on a max dose of prednisone, which probably sounds familiar to many of you, the steroid. The unfortunate part about prednisone is that it deteriorates your bone density, and I basically maxed out my use of that, just short of ending up with any. I ended up getting bone density scans, and I was fortunate enough to not experience any extreme deterioration in my bones. This also transitioned me into maintenance therapy, which was, I told you guys in the previous part, that my transplant doctor said I was going to have to do because my counts weren't recovering to the point where we knew if I was in remission prior to transplant. And so kind of the safe way to go about it was to do a year of maintenance chemotherapy. This chemotherapy was called Vidasa. Azacitidine is the official name. Vidasa, I think, is the corporate name. This was daily shots for a week every month, and this process was it was a lot more simple than having an inpatient stay, because I get to come in, get the shots, and leave. But it was very painful. You would get these shots either in your thigh or on your stomach, usually a more fatty area where it's easier for them to inject. And what would ultimately end up happening is I would get these really big red surrounded bruises that were painful to the touch, and any movement that you do, you feel it. And it was this on top of pretty significant stomach issues that bothered me throughout pretty much that year. It never really changed. It was just anytime I would start to recover, I would have to go get my next shot, and then I would go through it over and over and over again. So I transitioned into that, started doing those treatments. My treatment adjustments were initially included venetoclax alongside the Vidasa, which would be to help the effectiveness of just keeping me in remission and assuring that the cancer doesn't come back. My cell recovery was just inadequate, and so they ended up dropping the venetoclax, and I just stayed on the Vidasa treatment for the remainder of the year. Like I said in the previous part, a very crucial benchmark for bone marrow transplant patients is that first 100 days. And as difficult as that 100-day process was, it didn't stop after that. So like I told you guys before, I was going constantly in for some sort of either medications, transfusions, any of these things, just daily hospital visits, checkups, tests. It never ends. And post that, I finally got to that critical 100-day mark, and we decided to celebrate by, masking up, covering myself up, making it as safe as I possibly could to go out in public for the first time. We decided to go see a movie in the theaters, and we covered the seats and we made sure it was as safe as possible. And timeline wise, if you guys remember, this would be right around COVID. So right after the movie, we get home. The very next day, the entire country goes on lockdown, and it was one of the hardest things for me to deal with mentally, because I just, in my head, was measuring, I need to reach this 100 days in order to get some semblance of freedom back and some type of, social experience, some type of living my life outside of just being in this tiny bubble of MD Anderson visits and the apartment that we were staying in which I couldn't really move around too much because of how much at risk I was with my new immune system. So that was the first part that really was difficult for me to digest in regards to the COVID situation. And then sure enough, it gets worse because through all these new implementations that they have for the testing process and making sure that you don't have COVID and have you been in contact with anybody that has COVID, led to MD Anderson actually not allowing any visitors outside of extreme situations to accompany the patients to their appointments, anything inside of the MD Anderson premises. So I essentially had gone from having the support system and having my mom in this case helping me through all these appointments and being there for me, to now all these appointments are going to be done solo. And to me, I feel almost bad because I was on the easier end of my treatment journey, and I can't even imagine what people that are just starting either conditioning or getting ready for a bone marrow transplant or any of the, or just starting treatments in general, having to go and do all these treatments with nobody by your side because of these COVID restrictions. And that, I would say, became a really mentally taxing part of this following year of getting these treatments. Luckily, I still had obviously my transportation and everything. They were always waiting for me right outside once I was finished up. But going through the day-to-day process, it's draining, and not having somebody by your side through it can be really difficult. And I can only imagine how much more so for those, like I said, at different stages of their treatment. So going forward, I still had ongoing health issues. I had several infections. I underwent a colonoscopy because I kept having stomach issues and they were trying to get to the bottom of that. I ended up with BK virus, which is a common, I think it's a form of like a urinary tract infection that is common in transplant patients because, again, your immune system's just so fresh and new that it's not fighting at the level of most adults. And this it affects a lot of immunocompromised individuals. I ended up getting a spinal tap done to make sure that I didn't have any cancer inside of my spinal cord or in my brain. This was a concern that the doctors had, that it wouldn't necessarily show up in the regular blood test, but if you had a cancer forming inside of your spinal cord or your brain, they needed to do the spinal tap. That's another process that's not fun at all, let alone the situation I was in where they had to perform it inside the hospital bed in the room with my parents because I was just at the time so immobile and weak and going through, like I said, all the other complications. So that was the ongoing health issues. And after that, we attended survivorship meetings, and they assigned a person for you to kind of just go through the process of what returning to normal life might look like for you. And that was, again, just part of, I don't know if all hospitals provide this aftercare kind of, mentorship, I guess. But at MD Anderson, they did it, and they basically set up my scheduling of how I'm going to have to visit every 3 months for a period of time to get a bone marrow biopsy, go through all of my testing, pulmonary tests, heart tests, you name it, skin tests, everything. And this would be 3 months for a certain amount of time. If everything was going well, then it would become 6 months, and it would keep extending over time to eventually, the goal is there's no officially being cured of leukemia. Unfortunately, it's dissimilar to other cancers in that way. But if you reach that, it's the 5-year mark is what's considered a survivor. And basically these checkups would have to take place incrementally all the way up until that 5-year mark, which I will be coming up in this upcoming November, will be the 5-year mark for me to officially make me a survivor. So this is basically the entire journey crunched down into a bunch of slides and me presenting it to you. There's no way for me to really convey the weight of all of it just in these, what might seem like a long video to the general person. Is it's a very condensed and simplified version of what actually took place in our lives, from my stance and where I'm sitting, from my parents as caretakers, the family impacts that are had from it, and even things going forward. It's something that's ongoing and probably will be so forever. As it gets more distant, it does get a bit easier, just due to, obviously, if results are looking good, then you get more time in between your checkups. And like I said, after the 5-year mark, hopefully everybody makes it that can make it to that point. And then from there, you kind of have to take your own health in your hands and live the best lifestyle you can to give yourself the best shot at not experiencing a relapse. And I think that most people that go through this, especially when it's something so excruciating and exhausting and takes such a hold on your life and changes it to this extent, I think most people would be keen to make the right decisions and to practice a healthy lifestyle, maybe quit previous life choices that they used to make, maybe less drinking, whatever it is, just giving yourself the best shot at a healthy life moving forward for as long as you can. So that's pretty much the entire breakdown. And I think in the next episode, I'm going to dive more into the more about survivorship, and then kind of how infinite motive was woven in throughout this story to ultimately where it is today. Thank you guys for following along. It's been a hell of a journey for me. I never anticipated dumping this all out and giving it to the world, but I hope, as long as it can help some people and bring attention to this and ultimately help us unite the fight and spread cancer awareness through this brand, Infinite Motive. Thank you guys for everything. Be sure to like, comment, follow, and subscribe. The more eyes that see this, the more times it can be shared and commented on. That's how we can make the attention to this brand and to this story spread. And I can only do it with you guys. Thank you for your time, and I'll see you next time.